The following is a presentation of Project Independence and WCWP. Project Independence is the Aging in Place initiative of the town of North Hempstead. We provide programs and services designed to assist and support the older town residents who wish to remain in their homes as they age. If we don't currently provide a service, we will try and connect you to that service. Call 311 or 869-6311 to get more information or receive services.
Welcome to Project Independence and You.
Hello, welcome back to Senior Talk Radio here on 88.1 FM and WCWP.org. This is Project Independence and You. I'm your host, John Ryan, and my co-host today is Otto.
John, I'm looking forward to the next segment.
Well, we have a wonderful segment coming up with Dr. Kohli, and Doctor is with the Northwell Health Geriatrics, and she works with Maria Carney, who is a very good friend of the town of North Hempstead and of Project Independence, and has always been there for us. And now we have Dr. Kohli, who the conversation today is vaccinations, and especially this time of year, where people have so many questions about the appropriateness. Is it necessary? What time do I do it? What are the side effects, etc., etc. So first, I'd like to start off, Doctor, by saying thank you so much for taking the time out of your schedule, which I know is busy, to participate on this radio program. And before we even start about the vaccinations, how did you get involved in the geriatric part of medicine?
Well, first of all, thank you for having me on the show. I initially got interested in geriatrics when I was a resident at Jamaica Hospital. I did a rotation at Flushing Hospital, and working with the geriatric population really intrigued me and allowed me to think at a different level. And I feel as if a geriatrician needs a special type of care, and geriatric populations need a special type of care that only geriatricians will be able to provide. There's a lot of complications. They suffer with a lot of comorbidities as you get older. So all of that intrigued me, and I loved working with the patient population. It gave me the most satisfaction of all the patient population that I had worked with in the past. So I thought that this was the right field and I could make the most difference in this field.
Perfect. You know, that's the most important part of these things, you know, and I think agrees with me. When we have anybody that comes on the show, and the big burden of this is Christina's, we need a person, or we want a person who loves what they do. We don't want somebody who said, guess what, I could make an extra $10,000 a year by being in geriatrics versus pediatrics. We don't want that person on the air. It doesn't serve us any purpose. We want a person who owns the job, who loves the job, and wants to go to work. So right off the top of my head, congratulations and thank you, because that's what we're looking for.
Thank you.
Now we're going to go into vaccinations, because this is broad and we're going all over the place. But I believe now is the time people started within the next couple of weeks. And let's just give a nice overview.
Absolutely. So I have a few vaccines that I want to talk about, but I do want to first start off with.
We're here to listen to you.
I do want to first start talking about the flu vaccine, because I think that's the most important right now. So just a little bit about the vaccine itself, why it's important to take it annually. The first reason is a person's immune protection from the vaccination declines over time. So annually, vaccine is needed for optimal protection. The second reason why we need to take it yearly is because the flu virus constantly changes. So the flu vaccine may be updated from season to season to protect against the virus that research suggests is most prevalent during that season. And that's why it's important to take annually. The flu vaccine has been around for years and years, and research has shown that this vaccine helps prevent lower rates of cardiac complications, prevents the decrease in deaths, and even if you have had the flu for that season, you should still get the vaccine, because it prevents you from with severe complications of the virus. So for example, if you have had a heart disease and you get the flu vaccine, it is shown that, say that you do get the flu, if you had the vaccine, your complications of the virus itself will be less. You'll have less ICU stay, you'll have a reduced rate of mortality, and less decreased hospital stay. And the studies show, the epidemiology show that about half of Americans still don't get the flu vaccine each year. And the reason why it's so imperative to get the flu vaccine this year is because we know that vaccines are generally truly intended to minimize the severity of the illness. And because if you have the flu and then, you know, by any chance you get COVID-19 on top of that, you will be in extreme danger. Your life can be at risk because you have two viruses to fight at this point. And we know that while the vaccines are not 100% protective, but they could make a difference between a serious case, meaning hospitalization or even death. So it's super, super imperative, especially for people older than 65 years of age. So for people who are 65 years and older, there is a specific flu vaccine that is given to them that stimulates a stronger immune response, because these patients are considered high risk for serious complications like cardiac death, all those things.
That particular vaccination, one second, Otto, is for everybody over 65, and then you have the one that's under it, pretty
Yes.
much.
Pretty much,
Okay.
yes.
Christina's the one that always knows that every year when we discuss the vaccinations. Otto, you had a question?
Yeah, what do you think are the reasons why people would not get the flu shot? What hurdles are there that to overcome to convince people, you know, why don't they want to do it?
So there's some misconceptions about the flu vaccine that are out there in the public health. And I'll talk about some of them. Some of them are the vaccine they think will cause the flu, but it's actually not the case. The vaccine does not cause the flu because it's made with either an inactivated virus or a non-infectious viral protein. So there's no way that the vaccine itself can cause the virus. But that's one of the misconceptions. A lot of people think that, hey, listen, I just got the vaccine and now I have the flu, right? But what happens is so people say they get the vaccine and 2 or how many weeks later they have the actual flu. But that doesn't mean that the vaccine caused the flu. That means because your body needs time to build up the immunity from the vaccine. So they may have gotten the flu vaccine in the time being when the vaccine didn't take its full effect. But that doesn't mean that the vaccine itself caused the virus in you, because there's no way based on the things that it entails that it can cause the virus itself. Like I said, it's an inactivated virus or it has the protein. So
You think that's the major reason that people do not get the flu shot?
So I think that's one of the reasons. And then I think that some people are afraid of the risks sometimes. I think that they'll think that they'll get some serious reactions to the vaccines, and that's not the case. You can have a fever the next day or a sore arm. It can make you groggy for a day, but then those are just a 24-hour symptoms and they kind of go away if you just take Tylenol. But I think those are the main reasons. At least that's one of the main questions that I hear in clinic is, listen, doc, I don't like the side effects, or I think that the flu vaccine is going to give me the flu. I hear that all the time.
Okay.
And even those side effects that you're talking about, doctor, those are not everybody getting them, and they're short term.
Exactly. Absolutely. They're only for, like I said, 24 hours, maybe 48 hours period. Okay. And they're soreness, right? Redness around the area, headache, low grade. A low-grade fever may come, muscle ache, nausea, and fatigue, but they only last for a day or so and they go away, and you can take Tylenol, and that would be the only thing.
A lot of the pharmacies already have signs out that the flu shot is available. Is it too early to get the flu shot, or is it good to get it as soon as you can get it?
So so that's a good question, actually. So the flu virus, typically the time for the flu virus typically is about 5 months, from November to March. And it varies annually from year to year. This year, we're recommending that people get the vaccine, the earliest that they can, because of the pandemic that's going on. So yes, I think that you should get the vaccine. If it's being offered right now, then absolutely get it. And you can get it, and I'm glad that you brought up where where you can get it, because I was going to bring that up as well. So you can get this from the pharmacies, from your doctor's office, at the health department. The college health centers also have this. And sometimes your company employers may be willing to give it to you, and even at some schools as well. And you can also visit the CDC website and go to, let me see, I might have the link here. You can just go to, one second.
No problem. While you're looking that up, doctor, it's a 5-month.
Health map.
Good. I'll ask the question later then.
You can just go to the CDC website. It's a health map vaccine. Find external, it's like a link that pops up, and you can just put in your zip code and you'll be able to find the center near you.
Okay, perfect. And anybody who doesn't have that information in front of them, call 311.
Yeah.
Call 311. They will hook you up to the link that doctor just spoke about, and then you'll find, and even North Hempstead gives out the shot at different locations throughout the town. So, but my quick question, just before we go to break, is there enough vaccines to go around, or since they know not everybody does it, they don't make as much?
No, there's enough vaccines to go around.
Okay.
It's not like sometimes shingles vaccines are hard to get. They run out quickly, but no, the Department of Health sends out enough vaccines that covers everybody. Even though half of Americans don't get it, that shouldn't stop people from getting the vaccines if they want to.
Right, they'll still have enough. And the amazing thing with all these situations is you have half the country getting the vaccine and the other half not, which really is, Otto, what we were talking about earlier. It's disrespect almost to the people who are trying to do the right thing, because you can get half a population is a good piece of the population that is, forget about them not taking care of themselves, they're not having respect for their neighbor.
Yeah, one of the areas that I find to be confusing is it seems like whenever you get a flu shot, they ask you, did you have a pneumonia shot? So a lot of people don't know the answer to that. I had to go through, I'll name the name. I mean, I go to one of the national drug chains for my shots, all right? Fortunately, they do keep a record, and I do know, but they didn't have it all. So I had to go back to my doctor to find out what they had as far as when I had my shots, because frankly, I do not remember. So anyhow, the point I'm getting at is, what's the story as far as the pneumonia shot is concerned, particularly for seniors, geriatric group? Should you be doing that? How often? Is it a lifetime thing when you get a pneumonia shot, or do you need to do it every so often? Maybe just give us a little rundown on that.
For sure. So let me just start off by saying what the pneumonia vaccines entail. So there's the pneumococcal bacteria that is covered by these pneumococcal bacteria, can cause pneumonia very commonly, but it can also cause meningitis, and if in severe cases can lead to death. So which is why the pneumonia vaccines are very important. And the high risk group are people age 65 and older. That's why every doctor emphasizes for you to get the vaccines. So the vaccines that help prevent against the pneumococcal disease, they work very, very well. The first one is the Prevnar, which is PCV13. And the other one is Pneumovax, which is PPSV23. Both of these vaccinations are recommended for all adults 65 and older.
Both?
Both of them, yes.
You could have them both.
But no, so I'll tell you when you can have them. So
Right.
they're both recommended. So the first one that we recommend that you get is the Prevnar, which is the PCV13, followed by the Pneumovax, which is the PPSV23, and 6 to 12 months after the first vaccine. Okay, patients who are 65 and older who have already received the Pneumovax, which is the 23, the PPSV23, they can get the Prevnar a year later from that vaccine. So I'll tell you which patients end up getting the Pneumovax before. For example, some health diseases, like if you have diabetes, or if you have like end-stage renal disease, or if you're a smoker, your doctor, or other conditions that your doctor may determine that you need the Pneumovax first before you've turned 65, then you may get that pneumonia vaccine depending on what the doctor thinks that you need. So if, say you turn 65 and you've already gotten the Pneumovax, the Pneumovax vaccine, which is the PPSV23, then a year later, you can get the Prevnar, which is the 13. The ideal schedule is you should get the Prevnar first and the Pneumovax later. But if you've already gotten the Pneumovax before you've turned 65 for some reason, then you can get the Prevnar a year later from that vaccine whenever you've turned 65. I hope that helps.
Yeah. Now you can get these shots the same as flu shots. You can get them in
That's what I'll tell
national.
you. Right,
Yeah.
absolutely. You can get, so where you can get them, they're available at the pharmacies, at people's workplaces, at the community health centers, health departments, and a lot of the local communities will hold sometimes like at the school or religious centers, you can get them too. I think 311 would be the ideal choice, but you can also go to CDC website and you can get it. They'll be able to tell you where you can get it. And just so you know, Medicare Part B covers 100% cost of both the pneumococcal vaccines.
Now, suppose, okay, I got these 2 shots.
Right.
Do I have to get it again in some period of time, or am I good for life with that?
So these 2 are good for life. So once you get the PCV13 and the PPSV23, that's all you need. If you're high risk, like for certain diseases, then your doctor may have a conversation with you if you need to get the Prevnar again. But for general, most populations, just those 2 is all you need.
Unfortunately, I know a number of people who are no longer here because of pneumonia. And a typical scenario for older people is they fall, they break something, and they end up in the hospital,
Yeah.
and they end up with pneumonia. Does this type of shot minimize the possibility that you would get pneumonia in that kind of scenario?
So yes, so most of this is actually the pneumococcal vaccines are for community-based people. They cover the pneumococcal bacteria. If you are in the hospital, there are other bacteria that are in the hospital, and you can get those as well. It depends. It depends what type of infection that you get for that pneumonia. If the infection is the most common, which is a pneumococcal bacteria, then this vaccine will help prevent you from getting it. But like you said, if you're in the hospital and you get a hospital-acquired pneumonia, it may or may not be a pneumococcal bacteria. If it is a pneumococcal bacteria, then yes, this vaccine will help protect against it. But if by any chance you get one of the other hospital-acquired bacteria, then this vaccine won't be able to help. This vaccine covers the most common cause of pneumonia, which is why it's given to everybody. But it gets a little tricky when you're in the hospital because those bugs are different and pretty severe.
Okay.
You know, I want to just follow up with what Otto was saying there. Doesn't this shot, in my mind, and I'm listening to the both of you, and you know, and I know Otto does his homework. doesn't it make more sense for this shot to be administered and then monitored via a doctor than the drugstore? It just confuses me that I'm going to walk in and get it, and then I'm going to mark my calendar for 10 months or 12 months, and they're going to give it to me again.
So what happens? Yeah, that's a very good question, actually. So what I would recommend that if you, whenever you go, say you go to a pharmacy and get this pneumonia vaccine, they usually give you a paper that tells you that you've gotten this vaccine from that place. I would take that to my doctor if I haven't gotten it from my doctor, because they will have the record of when you've taken it. I know that in our geriatric clinic, if a patient comes to us and they tell us that, doc, I got this vaccine at my senior center, we document in our health EMR that this patient has gotten this vaccine at this date, and then the next vaccine, if they want to come get it from us, we know that we need to get it at this date. So I think that no matter where you get it, you should keep your doctor involved, so everyone can be on the same page and it'll be less work for you. So,
I think like the drug chain that I use to get shots, I actually communicates the information to my doctor. So
perfect.
they have the record, like especially nowadays when they use like my chart or whatever, all of that is on your portal, if you will. And so the communication, I'd say with a major company like that is clear. I don't know about the others, but I agree with what the doctor said. You know, take a copy, you get a receipt that tells you what you did, give it to the doctor, and they put it on your record.
Right,
But
that
otherwise,
was my point, because too many people go out and they self-medicate and self-diagnose, and then all of a sudden they're going to sit down with doctor and they'll say, oh, I did that 3 months ago, but you didn't tell me you did that 3 months ago. Oh, and I did that a month before that. It's like, well, you should have taken 6 months. You know, because I don't know if the pharmacy is that attentive on questioning you. I mean, I've gotten drugs from the pharmacy that sometimes they don't bother to ask. And my wife is the one, she'll read it and she'll say, you're not supposed to take A with B. Why did they just, I said, I don't know, they gave it to me. So then she'll call my doctor and they'll say, no, they were supposed to cancel it, you know, whatever it is. But so therefore you do need the quarterback, so to speak, to turn around and say, Otto, this is not the time, wait 3 more months and get the next shot.
well,
You know, that's because we are not the professionals in this field. You know, we need people like you, doctor, to tell us what to do and when to do it, ultimately.
but what we've said many times is you need to be engaged in your own health management.
Right.
And either you or somebody in your family has to be involved, in my opinion, because you can't count on you have all kinds of different people who you could get involved with, and they may not all know what the other's doing or whatever. It's complicated.
Yeah. And everybody has a different opinion, too, at the end of the day, which we've all come across that, too. So, you know, too many people, especially, and sometimes I do find fault, like at a senior center, you're sitting at the table, and I'm going to tell you, Otto, don't take that, take this. Well, what do I know? You know, it may
But I
have worked
saw
for
it
me,
on
but
the
it's not the right
internet.
thing to do.
I saw it on the internet, John.
Oh, exactly. Yeah. Oh,
It's
that
gotta be
diagnosis.
true.
I love those. You know, somebody told me they had to have surgery. You have to have surgery. Why? We have time for a quick story. My mother-in-law is fine, but 7 or 8 years ago, she was in a terrible, terrible car accident, broke her legs and different things, was put back together, and she's fine. We drove to the hospital that night to be with her, and the doctor's talking to her, and he says, any other conditions you have? And she says some condition. I don't remember what it was. It makes no difference. And he says, what do you have? And she says it again to him. And he looks at my wife and he looks at me and he says, who told you this? And she says, Dr. ABC. And he says, where does he practice? And my mother-in-law says, oh, he told me on the radio. Everybody was like, oh no. And the poor woman is almost delirious after a terrible accident. But she heard it on the radio, and she's telling the doctor she has this condition. And it was a comedy in the middle of a very bad situation that turned out fine as time went on. But people go by that. They listen to the radio, they see it on TV, a commercial, and then they need to have that particular drug. That's,
They don't
doesn't always
realize
work
it.
that way, right, Otto?
Well, they don't realize some of it is a commercial, and they're pushing a product, some super pill that'll take care of everything.
It's very important to keep your doctor involved in the medication, especially the medications that the geriatric population takes, because a lot of these medications, they interfere with each other and can cause serious harm. So especially supplements that you might think are okay to take, I would even suggest to bring that over to your doctors and make sure that it's okay to take them with, if you're on blood thinners or certain heart medications. Those are one of the most important ones that they affect. So especially good to keep your doctor involved with that care.
This is a
Actually,
I'm sorry, but this is a different thing. But philosophically, you share with your doctor. One of the problems some of the people in my category have is they're afraid to tell a doctor what's really going on. They don't have an open dialogue, and they don't want to look like they're telling a doctor what to do. I encourage seniors, please do not be afraid of your doctor. Tell them what you're thinking, because otherwise they don't know. It's like being a veterinarian dealing with a dog. I mean, a dog can't tell you, but a person can.
with Dr. Kohli, who is with Northwell Health Geriatric, and I want to compliment you because we've had many people on the air, and Christina does a wonderful job making sure that the people are number one in their field, and you definitively are number one in your field, but you're also a very caring and compassionate person. The way you're answering these questions, you're giving Otto and I the time we need to understand it, which means our listening audience is also feeling the same. So I want to thank you very much for that. It's very important.
I'm glad I'm doing my job. That's excellent.
Otto, you had a question in reference, not a question, you started talking at the end, and we kind of cut you off, that people don't really tell what's going on.
Well, doctor communication, I guess, is a subject that it is longer than we want to do on this show. But I do believe that to communicate with your doctor openly, honestly, be prepared with questions. Tell them what's going on. Let them know what you really do take as far as medication goes. The battle of medications, I don't believe there's any pharmaceutical company on the planet that's been able to test every combination of all the drugs that can work together. I just don't believe that they can do it. That's my opinion. Based on no knowledge, just on common sense that says it seems like it would be impossible. There's just too many medications. But anyhow, the point being, all I'm saying is to the listeners, really, don't hesitate to have open, honest dialogue with your doctor. Otherwise, you're wasting both of your times, to be blunt about it. And in some cases, unfortunately, a person may have difficulty communicating. That's a different problem because of a problem they may have, either a memory problem or some kind of disability or whatever. Then you need help. You need somebody to back you up. And that's not easy either. That's another
And
topic.
unfortunately, with COVID right now, a lot of places, unless you have to have a person, want you going by yourself.
Yeah.
A lot of facilities aren't asking you to bring a trusted advisor or a friend to something with you unless it's absolutely positively necessary. And that's where a family member has to turn up and speak up and say, I know my mother's not going to tell you the truth. Well, my little sister doesn't know everything that's going on. So, we have to be a little bit more understanding. But, again, with the pandemic, you're putting an emergency room, you're putting a waiting room, you're putting the doctors themselves and the nurses at risk. So it's a difficult time that we're dealing with right now.
Well, the support system that somebody might have when they go into a hospital is not there now. You can't have people
Right.
in. Whether
Which makes this more of a time to advocate for yourself,
right.
and especially and I think especially at clinics, if the patient is somehow impaired where they can't advocate for themselves, we do allow like one family member there to advocate for that patient. but I cannot stress how important it is to do advocate for yourself, because the only way we as physicians will know what's going on is if we have that trust with the patients and they're able to communicate with us without feeling any restriction, because we're not there to judge, we're there to help and be helpful in any way possible. So it's good to have that relationship with the patient, so they're able to share that with you without any hesitancy.
And even, Otto, what you were talking about a little while ago at the break, and then we've started back, you know, I believe, and you could correct me, doctor, the more information you tell the doctor, I'm not talking about bring a diary from the day you were born, but the more information you can tell the doctor, it makes your job a little bit easier. Because, you know, during this pandemic, I don't have a big time watching TV, it seems, anymore. But what I have been watching is House. I don't know if you've seen House with the doctor. And it's so, you know, it's a great show because it's
That's old.
45 minutes into it before the person tells him all the symptoms. And he wants to pull his hair out. He says, but why didn't you tell me you started eating squirrel 2 weeks ago? Or some ridiculous thing. But it's the truth. So the person who comes in and gives you a nice list of information is your best patient. You know, they're helping you. This is not a guessing game. You want them to help you help them, is basically what I'm trying to say.
Agreed 100%.
You know, and you see it, but that's in everything. We talk about this, Otto, sometimes in finance. You talk it in legal. You know, no matter what you're trying, we're going to have Dahlia on in a week or two. You know, if you're trying to buy a house, you got to tell the realtor what you're looking for. If you don't want a ranch, you got to tell her up front you don't want a ranch, versus going to see, you know, 3 ranches. And so it's not even from a vaccination point of view. It's patients that Dr. Kohli would be seeing even on a regular basis, not just this time of year. But as a senior, listen to this program, you know, and there's nothing wrong in going in, like, I know earlier in the show you had a list of things you want to review as time goes on, you know, like from a Democratic and Republican, and where are you? Who am I?
Yeah, well, like, yeah, that's a different topic, but anyhow.
No, a different topic,
I
but
don't
mean,
think
it's
I'm
the
either
same thing
one.
with
I'm
medical.
in the middle. But, you know, just to go back to vaccines for a minute, one that I've also had the pleasure, not the pleasure, but the experience of knowing a number of friends get shingles. And it was terrible, all of them. I can't tell you one of them that had a good time with shingles. You know, it was bad. One had it in the throat, another one, you know, it itched all over the place, couldn't get to it, whatever. And so this leads me to the shingles shot, which is also one that I have told people, get the shingles shot, and they look at me like, you know, well, why should I do that? You know, and you know, some people you just can't get the message across. But I'd like to talk a little bit about the shingles shot, and frankly, my opinion is you should get it. But I'd like to hear what obviously a professional has to say about it.
I agree with you. I think you should definitely get the shingles shot. So actually, let's start off with just the stats for a little bit to help people understand the mindset of this and why it's so imperative. So we know that 99% of Americans 40 years and older have had the chickenpox, even if they don't remember having the disease. The chickenpox and shingles are related because they're caused by the same virus called the varicella zoster virus. After a person, they recover from the chickenpox, the virus becomes dormant or inactive in their body, and it can reactivate years later and then cause shingles. So what is shingles? Shingles is a painful rash that usually appears as blisters, and sometimes can come with fevers and chills and some headache. Very rarely, if it can cause blindness, hearing loss, and brain inflammation. In medical terms, we can call them encephalitis or even death, very rarely. And a common complication for shingles that is very common in people who have shingles is that it can cause long-term nerve pain called post-herpetic neuralgia. This is pain that occurs in the area where the shingles rash was present even after the rash is cleared up. And this pain can last for months to years after the rash goes away. That's why that's the most debilitating part of this whole shingles ordeal. And then the risks of shingles and the post-herpetic neuralgia, the pain that associated with it, increases as you get older. So people who are 60 years of age and older are at increased risk of getting these because your immune system is lower as you get older. That's the main reason. So there are actually 2 vaccines that are available in the United States. One is the Zoster vaccine and one is called Shingrix. Since 2006, since 2017, we actually promote Shingrix more than we do Zoster because Shingrix is, it works more effectively and the studies have shown that a lot more people who've had the Shingrix vaccine compared to the Zostavax vaccine have had more protection towards shingles and the post-herpetic neuralgia. The CDC recommends that people who are 50 years and older can get the Shingrix vaccine. It is a 2-dose vaccine, and it's given separately by 2 to 6 months. So your second shot of the Shingrix vaccine can be given 2 to 6 months apart. And it is super important to prevent shingles and prevent the complications from shingle, which is the post-herpetic neuralgia. Shingrix is considered about 90% effective, Shingrix, while the Zostavax was about 51% effective. That's why we recommend the Shingrix now than we do the Zostavax. And we recommend that you get the Shingrix even if you've had shingles in the past, you've received Zostavax, are not sure if you've had chickenpox. There's no maximum age limit defined by the CDC for Shingrix. Oh, and then where to get this vaccine. This vaccine is available at your doctor's offices and pharmacies. You can, like I said before, you can find where to get who has so the problem with the Shingrix vaccine is sometimes it can be at back order. So when you go to the pharmacy, they may not have it. So a good way of finding if a pharmacy has it or not is I would call the pharmacy if you can, or you can go to the CDC website, like I mentioned before, and visit the Health Map vaccine link, and you can try to find it through there as well. It's a pretty safe vaccine, and studies show that it helps create a strong response against the shingles, and you may get very temporary side effects from the shot. Like you can get fever, stomach pain, nausea, headache, some feeling of dizziness, but they only last for 1 to 2 days, and that's really it.
This is Project Independence and You. I'm your host, John Ryan, and my co-host today is Otto. And we are having a wonderful, wonderful conversation with Dr. Kohli, who is from Northwell Geriatrics. And this is our last segment, and it's amazing the amount of information that the doctor has shared with us today. But what I want to do in this last segment is kind of do a wrap-up because there's just so much. We have 2 pneumonia vaccinations, the flu shot that we're talking about currently, the shingle shot, and then one more that you wanted to talk about. And that's why I'm a big believer, and you need the quarterback, because you're not just going to be going around town, different pharmacies finding out who has what. But what was this last shot, just as we were going to the break, that you wanted to talk about, Doctor?
Yeah, just really quickly, I want to talk about the Tdap vaccine. So it's a vaccine that's recommended for patients 60 years of older.
Okay.
65 is the highest that we say. So this vaccine covers tetanus, which is painful stiffness in the muscles. It can lead to serious problems, and diphtheria, which is a difficulty breathing, heart failure, paralysis, and also pertussis, which is the whooping cough. It is recommended that this vaccine is given to adults for protection of those three diseases that I just mentioned. And a booster should be given every 10 years. These are also available in the same places that we talked about before. It's imperative that adults who are going to be around grandchildren get the Tdap vaccine to have a cocooning effect for the whooping cough for children as well, for their grandchildren. It's like a herd effect. So if they take this vaccine, they kind of prevent that from giving this to the children as well.
Doctor, could you just say that slowly? That first part was Tdap?
Tdap, yes.
T like the letter?
Yeah, T as in Tom, D as in dog, A as in apple, P as in parrot, Tdap.
Tdap, just what I thought. Okay.
Okay.
Yeah.
And that also is, I didn't catch one part of it. This is between 60 and 65, or at
No.
60, but definitely over 65.
You can actually, you can get Tdap vaccine starting at the age of 11 and 12.
Oh, okay.
So it starts pretty early, but I'm saying, like, as you get older, it's one of the vaccines that you should definitely get to prevent you from those three things. Like, if this kind of, say if you get a cut from a dirty nail or anything like that, it prevents you from getting tetanus. That's the first part of it, that type of thing. And then the other two are the other diseases that I mentioned. I just went through it quickly because I know we didn't have time.
No, I understand what you're saying. Again, time is, we're trying to get as much information out as possible, at least to get a senior to turn around and say, I have to look into this. And I always, Christina and myself always compliment Otto, because Otto does his homework. But there's many seniors out there that don't do anything till they're on a stretcher in a hospital, and then the question, like what we were talking about with insurance, or did you have that shot when you could have had it 2 years ago? Why didn't you? Everybody puts everything off, but in some cases they put it off because they didn't know about it. And I think that's the benefit of a show like this. We try to bring everything to our listeners and our viewers, because this also is now on TV, but we bring it to everybody's attention. So my partner Peter and I say it all the time: no choice is a choice. So if you choose to do nothing, that's a definitive choice you're making. Otto, you had something I see like to say?
Yeah. That just to clarify now, this Tdap covers tetanus,
Yes, diphtheria and
and
pertussis.
and whooping cough.
Yes, yep.
It covers all of those.
It covers all of those. And the whooping cough is important if, grandparents are around babies and young children, because this bacteria can cause, significant conditions in the babies and young children, because whooping cough is very, commonly seen in young children.
I wonder, like, one of the problems with shots, to me at least, is how do you know if you had it or you didn't have it, especially if one of these was like a booster every 10 years. If in doubt, should you just get the shot? Like, let's say you look back and you don't know, did I have that shot? And nobody else seems to know.
Yeah, so I'll explain. So with this type of shot, like the booster that I'm talking about that you can get every 10 years, you can either get it every 10 years or even earlier in case of a severe or dirty wound or a burn. So that is not a hard set limit. If you have, like, say you got the booster, I don't know, 7 years ago, and now you're walking in the street and for some reason, you get a dirty nail that goes in your foot, and you need to go to a doctor, you can be offered it again, because in this case, the severe or dirty wound, that's what the CDC website and everybody recommends, that you can get a booster every 10 years or earlier in the case of severe dirty wound or burn.
You know, in line with John talking about me preparing for this show, I actually tried to backtrack and find out what shots I had over the last, over the last 10 years or whatever. And there's one on the list called Zoster, Zoster.
Yes,
What is that?
that's what I talked about with the shingles. I told you that there was two shingles vaccine, the Zoster Vax and the Shingrix.
Oh, so I had the shingles shot. I had that one 10 years ago, but then I
Right.
also had the Shingrix.
Right, that's exactly what I said. Even if you've had the Zoster Vax, we recommend you get the shingles because the Shingrix vaccine cover is 91% effective, while the Zoster Vax is 51% effective.
Okay, Zostavax. That's
Yeah,
I
that's the
have,
one.
well, I got Zoster and Zostavax. Are they the same?
No, Zoster Vax, I think, is the right one.
Well, the other one says Zoster, which I had.
Zoster,
Yeah,
Zoster is like the disease's name.
I don't know. I had that shot 2 days before I had the other one.
Did you have that shot, or maybe that was for the puppy? You got them confused, man.
I think that my point there is that a lot of us are totally confused as to what we actually did have in the past as far as shots go. Like, I told a story offline. When you're in the military, in the Navy I was, you go in, you're in boot camp, and this is not a make-up story. You go down the line and you get 5 shots in one arm, 5 in the other, and you just keep going down the line. And for several days you're sick and tired and you're sore, but you have no idea what you got. You know, I have no idea. Now, in line with that, as you get older, you get shots. Sometimes you have no idea what they are either. So what you just said was important to me personally, and might be to others, is this Tdap is one. I have no idea. I don't think I got it in 100 years, and probably is one I ought to ask for.
Yeah.
Maybe there's times where you have to ask your doctor about the shot.
And they'll tell you. And they'll tell you based on your history if you should get it or not and how long it's been. So it's a good question to ask.
That's now on my question list.
Good. I'm glad.
And Otto, with your level of records, you can obviously go through it and the doctor can turn around and say, listen, even if you did have it, maybe, but it was at least 12 years ago, you could have it again. I don't know what the answer is. I'm just making that up, of course. But, and that's why I'm a firm believer in a doctor versus people trying to control these things, because all of a sudden the piece of paper goes in the garbage and, you're getting another vaccination that you don't really need. And I think it's very important. We're basically almost out of time. Doctor, I want to thank you very much, and I wish you a wonderful weekend. That's it for this week. You've been listening to Senior Talk Radio here at 88.1 FM and WCWP.org. Have a great weekend, everyone.